we talk about the lymphatic drainage, and mammary gland is important in the upper limb to discuss. You have to understand a rule. Rule is lymphatic follow vein, follow artery. What is that? The rule says lymphatics will follow veins, will follow arteries. You mean to say vein follow artery? Yes. And lymphatics follow vein? Yes. Does that mean the lymphatic follow artery? Yeah, you can say lymphatics follow artery. That is not a problem. Very often lymphatics will definitely follow artery, but usually we say lymphatic follow vein. So what about that? Mammary gland. You remember the blood supply of mammary gland? This was the midline of the body, and this is the mammary gland on the right side. It was supplied by some artery, so it is followed by some vein. Internal thoracic vein, lateral thoracic vein. So there is some internal thoracic vein following the internal thoracic artery. Yes. And lateral thoracic vein which is following the lateral thoracic artery. Yes. Then there was other description. You will see subscapular vein under the scapula. Yes, subscapular vein drain the mammary gland. So subscapular vein will also drain the mammary gland. Yes. Okay, so we're talking about some veins which drain the mammary gland. They are internal thoracic vein towards the subclavian vein in the neck region. Yes, and lateral thoracic vein towards the axillary vein in the axilla. Yes, correct. That is going to be axillary vein, and this axillary vein in the axilla will then continue as the subclavian vein where the internal thoracic vein was draining. So crossing the outer border of rib 1, yes, crossing outer border of rib 1. So it's telling that there's an axillary vein crossing outer border of first rib and then entering the neck region to become subclavian vein, receiving the internal thoracic vein from the mammary gland. Yes. And the lateral thoracic vein and the subscapular vein drain into the axillary vein. Yes. Now remember about the lymphatics follow the veins. There are some lymphatics which are majorly, the lymphatics are going towards the axillary lymph node. So mammary gland is basically draining mostly about the axillary lymph node. How? See, this is anterior axillary lymph node on the anterior wall of axilla, pectoral major, along with the vein which is called lateral thoracic vein. So along with lateral thoracic vein you have which lymph node? That is anterior axillary lymph node. And why would you say it is anterior axillary lymph node? Because it is on the anterior wall of axilla, where on the pectoral muscles. So it is on the pectoral muscles. That's why it is called anterior axillary lymph nodes. Yes, following lateral thoracic vein. And what about the subscapular vein following lymph node there? The lymph node which are following there is obviously the posterior axillary lymph node. Why would you say they are posterior axillary lymph node? Because you know they are on the posterior wall of axilla. If you remember, posterior wall of axilla formed by the subscapular muscle, and this is the subscapular vein, and this is the posterior axillary lymph node. Then who is having the lateral axillary lymph node? Actually, laterally, there is a humerus bone. Humerus bone has the axillary vein. So these are the lateral axillary lymph node. So those are the lateral axillary lymph node, and they are following the axillary vein in the axilla. Yes, humerus bone. Humerus bone is lateral wall of axilla. So lateral axillary lymph node or humeral lymph node, which are following the axillary vein there. This is the basic idea. You mean to say anterior is the pectoral lymph node? Yes. And posterior axillary is a subscapular lymph node? Yes. And lateral axillary are the humeral lymph node? Yes. Then the three will drain into the central axillary lymph node, will then drain into apical axillary lymph node at the apex of the axilla. This is the diagram which we are going to discuss now. So you are telling that this is how it is draining. What is this happening? We have to discuss one more lymph nodes which are on the side of the sternum, parasternal lymph node. If you say on the side of sternum, which is parasternal lymph node, then I think parasternal lymph node should be. So on the side of the sternum, you have some parasternal lymph node, and they should be following the internal thoracic vein there? Yes, they are following the internal thoracic vein, and they drain the medial aspect of the mammary gland, because lateral aspect drain into the lateral aspect was actually draining towards the axillary lymph node, and the medial aspect of the mammary gland drained towards the parasternal lymph node running along with the internal thoracic vein. Now, once you say that this is the parasternal here, yes, these are the parasternal there. Following the internal thoracic vein, yes, parasternal cross the midline also. So, if there's a cancer breast on this side, there's a chance that it can spread across the sternum parasternal communication, and the other side also will have some metastatic problems. But this happens very rarely. This crossing, parasternal crossing, happens very rarely. Rarely it can also happen that mammary gland is sending the lymphatics towards the ovary or towards the abdominal viscera. It is, going along the lymphatics, retro course, reverse course along the lymphatics. You mean to say there is some lymphatic plexus with the peritoneum? Yes, it is actually called as subperitoneal lymphatic plexus, and it is retrograde kind of transmission towards the abdominal viscera, especially ovary, and that Krukenberg's tumor. So you are telling about some rare sites where the lymphatics can drainage. Yes, you see parasternal or crossing the midline, or it can be some peritoneal lymphatic spread retrograde towards the abdominal viscera, can be ovary like Krukenberg tumor. And what is the actual 75% lymphatics? 75% lymphatics actually come here. You see anterior axillary lymph node, which is pectoral, and is a posterior axillary lymph node, which is subscapular, and then there is the lateral axillary lymph node, which is the humeral, and where the three drain into center, and where the central axillary lymph node draining into the apical. This is the apical. So that is the apical. Yes. So you are telling that three of them drain into the central will drain into the apical. Where the apical will drain? Apical, if you see, this is the apical now here. As you see, this is the apical here. It is infraclavicular, or the apex of the axilla. So that is the infraclavicular, the apex of the axilla. Yes. Where is it draining then? It is draining the supraclavicle. And where the supraclavicle will drain? This is upper limb. What do you think where it will drain? Upper limb drain into the right-sided jugular trunk. And where the right-sided jugular trunk will drain into the right lymphatic duct, and where the right lymphatic duct will drain to right venous angle, jugulo-subclavian venous angle, junction of the subclavian vein and the internal jugular vein. We have discussed this earlier also. And on the left side, you don't have the right lymphatic duct. There you have the thoracic duct. Otherwise, drainage is similar, but here you have thoracic duct. Let us look at the diagram quickly. You have to understand this is the right axilla you are talking about, that there is anterior pectoral lymph nodes, anterior axillary or pectoral lymph node, and there are posterior axillary lymph node, which is subscapular lymph node, and there is lateral humeral lymph node. The three of them drain into center axillary lymph node, and after that they drain into apical axillary lymph node, which will drain into infraclavicular, then supraclavicular lymph node towards the neck veins. So this is the diagram. Yes, you see anterior is the pectoral lymph node, anterior axillary lymph node or pectoral lymph node, and the posterior axillary lymph node or subscapular lymph node, and the lateral axillary lymph node or the humeral lymph node, and all the three drain into the central axillary lymph node, will drain into apical axillary lymph node, which will then drain into the infraclavicular, supraclavicular lymph node, then drain into right venous angle if it is on the right side, and thoracic duct if it is on the left side, into the neck veins later. So right lymphatic duct on the right side into the neck veins later, and thoracic duct on the left side and into the neck veins later. Remember, there can be a sign which is called peel the orange, which is like a peel of the orange if there is a cancerous involvement of the subcuticular lymphatics. You mean to subdermal lymphatics? Yes, there's a blockage, and that blockage is because of the cancer cells moving into the lymphatics. So when the cancer cell move into the lymphatics, subdermal lymphatics, there is a block in the lymphatics. Edema, yes, lymphatic edema, and it is some pitting on the skin. So there's some pitting or peel the orange appearance. It's a sign of cancer involving the subdermal lymphatics.